Well, hello. I'd like to welcome you to April. April is Occupational Therapy Month, and our webinars this month are free and open to everybody. So I'm so grateful that you are here. I really thought long and hard about the topics I was bringing to you in April. And this one just really screamed out at me and said, we've got to talk about dyslexia and ADHD because it is one of the most commonly asked questions that I get. And that is, does my kiddo have dyslexia or do they have ADHD? Does one cause the other? Can they have both? Now, full disclaimer, I am not a diagnostician, so I'm not a psychologist or neuropsychologist. I am an occupational therapist. And in that spirit, I cannot provide a diagnosis, but I can certainly help you navigate the waters in terms of identifying which it may lean toward and help answer some of your questions of how to figure it out. So tonight's presentation is dyslexia or ADHD. So let's start off with what is the difference between dyslexia and ADHD? Because a lot of times some of the characteristics can look very similar, such as fidgeting or acting out and things of that nature. So when we think about dyslexia, and we're speaking specifically about developmental dyslexia, this is the type of dyslexia that's genetic and you are born with it. This is a language processing disorder. So it's taking place in the part of the brain that processes language. The prevalence rate is about 1 in 5. And typically the characteristics that are associated with dyslexia are being able to sound out words, have good fluency and not read robotically, spelling, reading, understanding what we're reading, and discriminating between where sound is within a word. There are many other characteristics, but these are the highlight characteristics that are most often tested and identified when somebody has dyslexia. ADHD, and in this case, it's attention deficit hyperactivity disorder, the prevalence rate is about 3 to 5%. And characteristics include inattention, distraction, hyperactivity, and impulsivity. However, with ADHD, they may not have difficulty with reading at all. So that's one of the nuances that is different. What are some of the things that go on when we're testing ADHD or dyslexia? For developmental dyslexia, it's typically tested by throughout a psychoeducational evaluation, a neuropsychologist or a clinical psychologist typically diagnose dyslexia. Some will provide a test for IQ, some will not necessarily necessary, but it can be done. They're specifically looking for how a person can navigate phonics, associating sound with a letter, different letter combinations, making up different sounds, spelling. Typically those with dyslexia spell the word the way a word it sounds and not necessarily according to phonic rules. Writing, do they have difficulty with written expression, getting words on paper, processing speed, and reading. And this could be anything from reading rate to fluency, comprehension, and accuracy. ADHD, or attention deficit hyperactivity disorder, definitely they're looking at IQ here. The physician may also do, and sometimes this can be done by your medical doctor as well. A physician will do a full, thorough physical exam. If they are being seen by a neuropsychologist, clinical psychologist for a psychological evaluation, they will be tested for IQ most likely and rule out other comorbidities or learning difficulties such as dyslexia. They will have a pretty intensive parent and child interview, do behavior ratings, and also some observations of the child. Now, with dyslexia, you can have some of these assessments as well. However, with dyslexia, you typically don't see a behavior rating scale being administered when it comes to diagnosing dyslexia. One of the things I always like to offer parents is a tool that you can have in your toolbox that will really help your physician. I don't know if this has ever happened to you, but as I go throughout the day, things come to mind that I may want to share with my doctor. And I'm thinking, oh, this is so important. I'm absolutely going to share this. And lo and behold, without fail, when I am at the doctor's, I forget all of that and it goes out the window. So I really encourage you to start keeping a journal. And there are several things to document in this journal. Why are we keeping a journal? Well, because we'll be able to identify patterns, and it's great information to share with the physician or the psychologist so they can provide a better diagnosis, really see the bigger picture of your child and not just what you share with them at that moment, not just what they see on testing, and not just how the child behaves at that moment. Because all testing does, all standardized testing will do, is identify what that child was able to do at that moment, but it doesn't take into consideration day in, day out, and your journal will certainly do that. So think about your journal and dividing into columns. You can do this on your smartphone notepad. You may do it on your tablet. If you're old school like me, I keep pencil paper, so however you want to do it. But your first column is going to be your time and date. What time of day and what was the date? This is really important. Did it fall on a weekend? Did it fall on a weekday? Why? Because what we do during those different days of the week are different activities usually. Some are more structured than others. Some we are around more people than others. So it's really important to know day and time. Time of day is important as well. Was it really late at night? Was it early in the morning? Were they exhausted mid-afternoon? Did they get sleep? What time of day did this happen? And then write down the characteristic that you saw that really interrupted with what was going on. Things such as crying, fidgeting, trying to avoid whatever they're being asked to do, having a meltdown, maybe joking around, being a class clown. Any of these things that are not on target with what you've asked them to do would be the characteristics. So just describe what happened. Your next column, you're going to write down what you were asking them to do or what activity were they working on. So let's say, for example, your child really struggles with reading or really struggles with math. So every time you sit down to do any type of schoolwork that involves either of those things, you see all those characteristics just, coming up and blooming. And so what is it that you were asking them to do? Be as detailed as you can. Were they doing homework? If so, what subject? Were they playing with their Legos? Were they playing with other children? What activity were they doing? Don't try to analyze it, just document it. In another column, you're going to describe if you were able to redirect your child. So for example, maybe they're joking around, maybe they're having a meltdown, and you're like, hey, I can see that this is really hard. Let's put this up and go do something else. And the minute you do that, they're fine. That is important to know. Why is that important to know? Because if you have dyslexia, that will most likely be your reaction. If you have ADHD, it's a little more complicated. So you want to know if you could redirect them or not. That's really important. Sometimes people who are diagnosed with ADHD also have medication. And again, I am not a medical doctor or psychiatrist, and I cannot prescribe, diagnose, or anything to that nature when it comes to medication. However, it is a type of therapy that's often provided. So if your child is currently on medication for ADHD, something to notice, and let me preface it with this. I understand that some medications may take 30 days to really be effective, or there is some time gap between the minute they take the first one and when it's really effective. And sometimes it's a little bit of a trial and error where you need the dosage adjusted or the type of medication adjusted. So again, all this information is so very helpful to bring into your physician. But let's say, for the sake of this conversation, their medication is regulated and it's at the just right dose for them. So they're on the medication, and what you've noticed a few things. Maybe you've noticed that they are able to attend more, there's less of this distractible behavior, and they're doing better in school, but they're still having difficulties with reading, or you haven't seen much of a change. So if they're doing a little better in school, they may absolutely have had ADHD. And if that is the case, and they're not having any more difficulties with the reading and learning, then it's most likely that they truly had ADHD. However, if they have ADHD and they're taking medication, you're seeing some improvement, but you still have that learning glitch, they may also have dyslexia. So there is about 30% of individuals have both dyslexia and ADHD, and that can happen. So it gets kind of really tricky tweezing out, why are we seeing what we're seeing, right? That gets a little challenging. The other thing is maybe they are taking medication and it's totally regulated. Everything in that regard is going fine, but you've noticed absolutely no change, not only in their characteristics that they are demonstrating, but no changes in the learning process either. In that case, I would bring up the question, do they really have ADHD? Because ADHD is very responsive to medication. You should see some type of positive impact, but dyslexia is not. There isn't any medication on the market that improves dyslexia. So I'll repeat that because it's worth noting again, if they are on medication and you're not seeing any changes in that positive direction of learning or lack of frustration with learning, and the behaviors or characteristics aren't changing, the likelihood that they may have dyslexia instead of ADHD is a possibility to very much discuss with your physician about. Then I would say keep this journal for at least a week as best as you can. I know sometimes it's hard to document everything, but the more you're able to document, the better. So do this for about a week. And then, when you have a few minutes of quiet time, just sit down and really look it over. If it is dyslexia, you should start seeing some themes. For example, every time they're working an activity that is requiring them to work on a skill that they haven't mastered yet, they have to remember their sight words, they have to remember their math facts, they have to remember what they're reading. All three of those things in common have memory. Maybe if they're struggling with all three of those things, their memory they could be struggling with how strong their memory is. That could be a dyslexia thing. So if you start seeing a trend, the likelihood is it is dyslexia. If there is no trend and there's some inconsistencies, then the possibility is it is ADHD. But again, that's not necessarily for us to diagnose, but these are things that your physician or provider will be looking for in these themes. And you can highlight this, point it out, and have that discussion with your provider. Absolutely. And then your very last column, you will start writing notes. Anything that comes to mind. Maybe they had a friend come over last night and spent the night and they just didn't sleep all night and they're exhausted. That could be a reason why they had a meltdown. Or maybe they just got a new puppy and they were so excited that they were distractible because this puppy is a cutie pie and they're constantly licking them and jumping all over them and they can't really get their homework done. So that would be another good reason. So write down any extenuating circumstances that you see. Are they hungry? When's the last time they ate? Are they eating food that's really fueling them? All of these outliers impact our ability to concentrate, focus, our mood, learning. All of these things are so, so important. This journal is the key to bringing information to your physician to help guide your family and to refine that diagnosis for your child. So I just want to recap that dyslexia and ADHD are two separate, distinct diagnoses. They are not the same, and one does not cause the other. They have characteristics that overlap. So keeping a journal and keeping track of what activity your child is doing, when they are doing it, what characteristic are you seeing? Can you connect the dots, any themes out there, making notes of any outlier type of information? That is a super helpful tool that you can create and bring to your physician as they're navigating the diagnosis process of your child. I really appreciate you joining us this evening. If you want to access our archived webinars, or you'd like to join us for any upcoming new webinars, we do about 2 or 3 a month. Please reach out to us at dyslexiarx.com and click on Join Community. Joining our Dyslexia RX community will not only give you access to all the webinars, but it'll also connect you with our community partners, as well as other families that are having similar experiences to you, where you can go to for support and like-minded community. You have a wonderful evening, and I appreciate hanging out with you tonight.